Hello, and thank you for joining us here today for this session entitled Making Strides Locally, Progress on Genetics Access in Your State, District, or Territory. My colleagues, Cheyla, Enrique, and I are excited to let you know about all of the efforts that have been occurring throughout the NYMAC region. So let's get started. I'd like to begin by sharing our financial disclosures. So for those who don't know me, my name is Radhika Sawh, and I lead our efforts for our 8 continental state teams. And I'm joined today by the lovely Cheyla Clark, who focuses her efforts on the US Virgin Islands, and the talented Enrique Lopez, who is spearheading our efforts in Puerto Rico. So I thought it was important to begin with a little bit of background about our team's efforts. So as you've heard, NYMAC encompasses the New York, Mid-Atlantic, and Caribbean region. So as you can appreciate, the needs will vary greatly based on where you are within the NYMAC region. Accordingly, individual teams have been created for each of our 10 jurisdictions. But the goals of all the team are the same. We want to assess the needs and barriers specific to that particular state, district, or territory. And then based on that, we'd like to implement a NYMAC funded project to help improve access to genetic services for that area. In order to accomplish this, we try to have diverse representation from throughout the state on our teams. So we invite genetic providers, families, other non-genetic healthcare providers, such as pediatrician and primary healthcare providers, and hematologists, neurologists, cardiologists, just to name a few, to join our groups. In addition, we try to get representatives from genetic counseling training programs and genetics residency groups to be on our teams, as well as the leadership from state genetics groups. We are also really keen to include representatives from the maternal child health bureaus, as well as the public health territories, so newborn screening, Title V, early childhood education. And we always do reach out to representatives from the state chapters of the AAP and other groups. And when possible, we also try to get representatives from pharma and relevant industries such as formula companies or even Medicaid. We really do try to do that. And we also make an effort to engage with underserved communities in the geographic area, which obviously vary depending on where you are. So across all of our jurisdictions, we strive to form a team of very diverse collaborators so that we are representing a lot of different perspectives. This is so that we can really try to understand best how the genetic system is working in that state, district, or territory. So as you can imagine, the teams are not always the same. So in some areas, we will have a lot of varied genetic providers and maybe non-genetic providers and a few families. And others, we have a lot more family representatives and more people from the public health domain. So it varies state to state, but we always do try to have a mix of both providers as well as families and public health, so that we hear from all viewpoints. So the way it works is that in the first year of a team's creation, we work together to define the key challenges in that area to accessing genetic services and focus our attentions on underserved populations, distance barriers, or educational barriers, both on the provider side or on the family side. And then we work together to identify what's that key barrier that we'd like to focus on. Once we've determined that, the team will brainstorm possible solutions and craft a project plan. In the second year, that chosen project is implemented, and we start to see how it is hopefully improving access and monitoring its progress. And then in later years, we look for further opportunities to improve upon the project and expand upon it. So later in this session, you're going to have a chance to meet with folks from your state, district, and territory to learn more about their project and how this process went. So this is the timeline that we have gone with. So NYMAC has a 4-year grant. It started in 2020. So in that first year, 5 teams were created: DC, New York, Virginia, Puerto Rico, and the Virgin Islands. In the second year, we created teams in Maryland and West Virginia. And recently, as recent as last year, we created our final 3 teams in Delaware, New Jersey, and Pennsylvania. So you may note that there are asterisks, and Puerto Rico and Virgin Islands are listed all 4 years. And that's because they have unique challenges in the Caribbean. So they actually follow a very unique timeline, which may differ from the timeline presented in my previous slide. And Cheyla and Enrique will go into that in further detail very shortly. So we thought it'd be important to begin with a quick poll to just see where everybody is joining us today. So if you could just take a moment to tell us, what NYMAC region are you from? Thank you so much for sharing. It's great to see that we have people from all across NYMAC with us today. So we're going to dive right in and start talking about what's been happening in every part of NYMAC. So we're going to start with the year 1 team. So our very first team out the gates was our group from New York. And New York decided that they wanted to focus on educating families about when they should be the ones seeking a referral to genetics. They wanted to empower families to feel confident to speak to their pediatricians about when they were concerned that something happening with their child may be genetic in nature. So what they did is they designed an infographic and an accompanying pocket card that focused on when is an appropriate genetic referrals, and also shared resources about different aspects of raising a child with special needs. So this flyer you can see up here was created and also translated into Spanish, and it was mailed out and distributed throughout New York State with the help of the parent-to-parent organization in New York. And you can find this flyer on our New York team webpage, which is part of the NYMAC region, and the website will be dropped in the chat just in a minute. And we also created a social media campaign to accompany this. So I'm going to play it now. So this campaign was launched in the second year after the infographics were distributed, and really was a great way of reaching more families and helping to empower them. It was so well received that the team, now in their 3rd year, decided to relaunch the campaign earlier this year and ran for 2 months. And we decided to expand the reach of the infographics, and they were sent to the American Academy of Pediatric chapters throughout the state. They were added to the state Department of Health websites, and they were shared with the New York State Genetics Task Force. Next steps for this team include translating the infographic into other languages common throughout New York State, and connecting with and sharing these infographics with federally qualified health centers. We're also trying to make connections with the Native populations in upstate New York, including the St. Regis Mohawk tribe. And we will be sharing these infographics at the upcoming New York State Perinatal Conference in June. So moving on to our team from the District of Columbia, they decided that they felt the biggest barrier toward accessing genetics in DC was trust. So they wanted to create a project that would support families to understand the value and relevance of genetics, and while concurrently building trust in the genetics community. So for their project, they created a My DC Genetics Journey videos, which featured local families who shared how they benefited from their genetic appointments. Our hopes was that by other families seeing these families and hearing their stories, they will feel more comfortable attending their own genetics appointments. And we could have never done this work without our close collaboration with the Advocates for Justice and Education organization in DC. If anybody is with us from AJE today, please say hi in the chat. And these videos are now on our DC webpage, so I encourage you to pop over and see them. They are available now in English and Spanish, and we are currently in the process of distributing flyers that share these videos through to various organizations in DC and community groups to share with families. And we recently also launched a social media campaign targeting the DC metro area. This is going to be, it's in both English and Spanish, and again, trying to reach more families to help build that trust in genetics so that these families can benefit from their genetics appointment. And so we're really excited to see how these videos are received. And if any of those families who participated in those videos are here today, please say hi in the chat. We are so thankful for you being so willing to share your stories and helping others along the way. So our final year one team on the state side was Virginia. So Virginia also wanted to educate and support families who require genetics, but they went through it through another avenue. And what they did is chose to adapt an existing program that was developed by our colleagues in the Mountain States Regional Genetics Network, which are called genetic navigators. So genetic navigators are parents who've gone through a genetic journey with their own child. And what we did in Virginia is that we collaborated with the family organization there, the Center for Family Involvement, and we developed the genetic navigator training add-on for volunteers and employees at CFI who had prior genetic experience, so that they can then provide family support to families new to genetics. So 10 genetic navigators were trained. Up here on the top is a map showing the 8 different modules that were used to train them. And here are some of the resources that were created to help explain genetics in simplistic fashion to them, and for them to also then explain to families who are new to genetics. So information on reaching genetic navigators can be found on our Team Virginia webpage. And we recently launched a social media campaign with the help of the great social media folks from CFI to promote this genetic navigator program. We also created a new flyer to promote and build support for the genetic navigator program among genetics and non-genetic professionals. This flyer is going to be shared at the Virginia Association of Genetic Counselors annual meeting, which is also happening this week. The genetic navigators will also be continuing to get together twice a year with other genetic navigators from the Mountain State Regional Genetic Network, as well as the New England Regional Genetic Network in May, to share stories and share experiences, and again, build their toolbox so they can help support families. And our next goal is this summer, we're going to be training our genetic navigators to learn how to reach out to early intervention professionals, because we feel like they're the ones that often work with families and recognize those families who are going through, who could benefit from genetics and should learn about the Genetic Navigator program. So again, just trying to disseminate information about this really, really great program so that families in Virginia can benefit from them. So I'd like to now tell you about two of our year 2 teams. Our team in Maryland really liked what New York did with the infographics, but they wanted to take it a little further. So they decided they wanted to make their own infographics, but make them so that they can be useful for both non-genetics providers who are considering whether or not to refer families, as well as for families. And so the goal of these infographics, again, is to help both non-genetics providers and families understand when is it appropriate to refer to genetics. And they made these flyers applicable for both pediatric referrals, general genetics referrals, so when people are adults, and cancer referrals. So this was a great effort by the Maryland team. I was really impressed. We divided and conquered and created 3 different infographics that you can see here, all available on our Maryland webpage. And they are, not only are they amazing in English, but they've now been translated and are available in Spanish, Haitian Creole, Korean, and Mandarin. They've been distributed throughout the state of Maryland with the help of our amazing partners, our family-to-family organization in Maryland called Parents Place Maryland, apologies. They've been amazing in helping us to really share these infographics throughout the different community organizations and throughout Maryland and different groups that they feel reach families, so that we can make sure families and providers are aware of when referrals to genetics are appropriate. We also created, in partnership with PPMD, a video series depicting the genetics journeys of local families. These videos are also on our Maryland webpage, as well as the PPMD homepages. And again, another way to just share with families why a referral to genetics can be beneficial to them. And in the future, we're looking to create an article in parenting magazines to again share the value of genetics. And we're hoping to participate in the Maryland and DC annual genetic counseling meeting in November. Also, we have a social media campaign currently running, again, sharing information about the infographics, and it's very similar to the one that you saw in New York. Now I'd like to turn to West Virginia. West Virginia had some really unique barriers because they have only one practicing genetic counselor in the state. And when I joined the team in June of last year, they were down to 1 geneticist for the whole state. So the team quickly recognized that they did not want to increase the number of referrals because they did not have the genetic infrastructure to support it. Rather, they wanted to help educate non-genetics providers about genetics and help them to better understand the value of genetics and when is an appropriate referral and what basic testing a non-genetics provider can do while waiting for a patient to be seen at genetics. So what the team did is create a funding opportunity for non-genetics medical providers to enhance their own genetics knowledge. And the very first proposal we actually received was from a team member who wanted to build up the infrastructure and educate the medical establishments in West Virginia about the value of genetics. So we helped to support the visit by an amazing genetic counselor and consultant, Dr. Colleen Campbell, to West Virginia Medical Center, and she gave a great grand rounds focusing on the importance of building a genetics infrastructure. And she had meetings with department heads and executives right after, explaining again why we need to invest in genetics. And it was a really well-received grand rounds, and the meetings were packed. And as a result, I'm happy to report that the pediatrics department hired 2 genetic counselors, and they're going to be starting in July. The institution is looking for more funds to hire more genetic counselors within different departments. A new geneticist has joined the team locums in January, and they hired another geneticist that will become the chief of genetics starting later on this year. And they've also hired a nurse practitioner with a focus in genetics. So really, you can already see the impact this has been having. We are currently assisting a neurologist at the campus in Marshall, who's trying to start and implement telegenetics there to better serve the West Virginia population who are not near the main institution. And we've also done smaller efforts there and supporting, again, non-genetics providers to attending educational conferences with genetics as their focus so they can improve their understanding of genetics. And this summer, we are talking about crafting an educational webinar aimed at pediatricians and primary care providers throughout the state, utilizing a grand rounds forum again to help them better appreciate when is an appropriate time to refer to genetics and how to best use genetic testing. So we're really excited about all that's happening in West Virginia. So I would like to turn the baton over to my colleague, Enrique, who's going to share with you what's been happening in Puerto Rico. Enrique?
Okay. Hello, everyone. So thank you, Radhika, for giving some background information on the continental states that NYMAC encompasses. And so with Puerto Rico, we're in a similar situation to West Virginia, where there are very few genetics providers on the island. So we have 4 geneticists for the entire island and 1 genetic counselor. And it's a little different in the continental US compared to Puerto Rico in the sense that 3 geneticists on the island actually work in a private office versus in a public setting. So when we came together to make the Puerto Rico team, we were trying to access more genetic services and more services for genetic counseling or genetic providers in general. And so the focus for the Puerto Rico team was to implement some telemedicine and genetics education programs for both patients and providers. On our first trip last year in 2022, we did some family training workshops on the topic of genetic services. We brought families together, and we did so similarly this trip as well. And it was an astounding turnout, and it was very beneficial for the families and for everyone involved, with many individuals being able to share their stories, hear from providers, and also just connect with organizations and other families on the island. So it was a huge success. We provided webinars and presentations about genetic services towards healthcare providers on the island. And that was also a success in the second trip, where we were able to talk in a number of different settings and give more information on that to other providers. We're also in this team collaborating with Columbia University's genetic counseling program. And so on both trips, we brought genetic counseling students. On the first trip, we brought 4. On the second trip this year, we brought 8. And so alongside supervisors that are genetic counselors, students were able to practice and also counsel patients in Spanish on the island. And so that was very beneficial for both parties. We're trying at the end of the day to have a self-sustaining model for genetic counseling services and some type of genetic services on the island. And so we're trying to collaborate and facilitate Columbia University and Ponce Health Sciences University to provide a curriculum for genetics training, and then very long term to potentially start a genetic counseling program on the island in some capacity. So it could just be self-sustaining. And then lastly, we're trying to work with stakeholders currently to find a path forward towards providing genetic counseling services for individuals on the island. And so currently we're working with third parties to provide telegenetic services to individuals on the island. We're trying to work on the legislative piece, certification for genetic counselor, since it's not a recognized profession on the island. So it's a multifaceted approach, and we're slowly gaining ground on and momentum on the objectives and the projects that we're undergoing. And on the next slide, you'll see some next pictures about the trip. So these are during the talk, starting from the left-hand corner going clockwise, one of the first provider talks that we gave. In the second picture, we have students at the clinic, as well as some of the supervisors. In the third picture, we have a dinner that we provided through NYMAC to bring everyone together and kind of de-stress and group. And then in the next picture, another provider lecture. In the fifth one, we were given talks by individuals on the island to understand more the services in Puerto Rico. And then the last picture, again, we have more students in the genetics clinic from this year. But thank you all for listening to talk about more information on Puerto Rico. And then I'm going to pass it on to my colleague, Cheyla, about the U.S. Virgin Islands.
Hi, everyone. Like Enrique said, my name is Cheyla Clark. I am here representing the U.S. Virgin Islands territory team and kind of review what we've been working on since the project started. So I started on this project in November of 2021, and we kind of hit the ground running recently. And so the focus is similar to that of the projects going on in Puerto Rico, implementing telemedicine and genetics education programs. So our focus on implementing telemedicine kind of looks like developing a model where we have a geneticist that can do telemedicine for the people on the island, as well as finding a pediatric hematologist that can see patients so they don't have to fly to the continental US or to Puerto Rico to get the services they need, and they can get them at home right where they are. So for some of the projects that we're working on during our team's visit to the VI in January and February, we both prepared and hosted family training workshops for parents of children with special healthcare needs, especially those with sickle cell disease and sickle cell trait, as that was one of the main identified needs of the providers and the families in the territory. So we provided education around foundational genetics knowledge, inheritance of genetic conditions, and focus on care and the needs of those affected with sickle cell disease and other hemoglobin disorders. We also had Jermaine, who's on the call right now. She's one of our amazing family leaders in the U.S. Virgin Islands, based in St. Croix, who has a really great family support group, and she did a really great presentation for the families there. Really thankful for her participation in helping us, get the family training up for the families there. We also provided a webinar that was based on the Learn the Signs, Act Early milestone. And we conducted that webinar alongside providers on the island who care for the patients and family, and also providers who educate future healthcare leaders in the VI. So that was a really great opportunity to collaborate with local stakeholders there and do a presentation about genetics for providers. Currently, we're working with local stakeholders, specifically the newborn screening nurses on St. Croix and St. Thomas, to create tailored newborn screening fact sheets, as well as developing a tracking system for their newborn screening program. We're also working on gathering the resources necessary to implement the telemedicine program for genetics care, recruiting a geneticist and a pediatrician for the maternal and child health department who can care for patients locally in the VI. And we also assisted the maternal child health department in applying for a grant that could secure additional funding for these projects. And we're hoping to hear good news really soon. So that's kind of a brief overview of everything that we've been working on in the Virgin Islands, with much more to come soon. And on the next slide, I have some pictures of our trip that we took in late January, early February. And you can see in the top left picture, we had a visit with the legislator on St. Thomas to talk about the identified needs that our stakeholders wanted to talk about. We had really good conversations there. The next picture was a really great team dinner we had at the end of one of our days to unwind and kind of just socialize with our local team in the VI. The third picture is during a tour of the hospital in St. Thomas. That was really nice. And right there on the bottom left, you'll see a double rainbow that we saw after a brief rain shower when we were on the beach in St. Croix, it was, I believe, with the families and the children. The middle picture at the bottom is our visit with newborn screening nurses, WIC nurses, and infant and toddler teachers. That was a really, really great meeting that we had. And then the final picture is one of our team, our NYMAC team for the Virgin Islands after our family training workshop in St. Croix. So thank you for listening to what's going on in the VI. And I'll turn it back over to Radhika.
Thanks, Cheyla. Lots of things going on in Puerto Rico and the U.S. Virgin Islands, and my thanks to Enrique and Cheyla for giving such a great overview of all of their efforts. And I promise you, there's going to be more to come. So stay tuned. And again, you can follow their, growth and what's happening with them through their websites, their web pages as well for the Puerto Rico and U.S. Virgin Island teams. So as I mentioned, our most recent teams are those that were created for the great states of New Jersey, Pennsylvania, and Delaware, all my neighbors as a New Yorker. So I was really happy to be able to be from the onset with these teams. We worked together to create them last summer, and we met for the first time in the fall, and we've been meeting monthly ever since, trying to really understand the different barriers that exist in these three states, which, although they all border each other, have very different issues that they all are dealing with. And so at the moment, for each of these teams, we're in the process of building a consensus around what is the key barrier that they want to focus on. And I can tell you, because I just recently, we've met with our group in Pennsylvania, that they really like what New York and Maryland has done. And it looks like they're also going to be focusing on education. And they also want to do a dual approach of reaching out to both providers and families to make sure everybody is on the same page. So we'll see how that project unfolds. We have yet to see what's going to happen with our friends in Delaware and New Jersey, but I'll be meeting with them in the next 2 weeks. So we will see where they want to focus their efforts and what project they feel is best suited to achieve those goals. So our hope is that projects for all three of these teams will be launched in the summer. But in the meantime, please, we encourage you to check out their team pages, which are new to the NYMAC website, and we're really excited to debut them today with you. On those websites, you can see who's on the team, find local genetic clinics in each of those states, and find also resources that are helpful for both providers and for families about genetics. So exciting things happening, and hopefully at this time next year, I'll be able to share with you progress being made in those three states as well. So right now, we want to invite you all to join a breakout room. We thought this is a great opportunity to meet people from your region. So whether you're joining us from a state, a district, or a territory, we want you to join and meet other people from your area and find out what's happening there. What are our next steps happening? Tell us what you think about the project and maybe how you think we can build upon it. Share any concerns, any feedback you have. And if you happen to be from outside the NYMAC region, there is a place for you to go as well. We would love to hear about your thoughts and help direct you to the regional genetics network in your area. So Fred, I'll turn it over to you.
Thanks, Radhika. Yes, those rooms are open. And so there are instructions in the chat for how to navigate to those rooms. Those of you who are moderating, you likely got an invitation to join the room. The rest of you, if you see a breakout room icon at the bottom of your Zoom window, that looks like the one the arrow is pointing to on the screen, that will bring up a list of rooms, and you can join the room of the region you want to hear more about, or you want to meet other people from. If you don't see that breakout room button, and you do see a more button with 3 dots, try clicking that, and that should give you an option to join a breakout room or bring up that breakout room menu. So these rooms will be open for the next 6.5 minutes, a chance to connect, and we will play music here in the main session in the meantime.
Hi, Fred. If whatever, you can let me share my screen. Enrique is going to take us home.
Okay, so thanks everyone for joining the breakout rooms and having some conversations about what's happening in their region. I wanted to close just mentioning and showing the NYMAC website, just reminding everyone that we have additional information on efforts by the teams on the NYMAC website, as well as resources for providers and families that are in Spanish in general. So we have a whole page dedicated to those Spanish resources. And then going to the next slide. With this slide just showing our emails, how you can contact me, Radhika, or Cheyla. And then as well, there's a Google form in the chat that you can also fill out, and it'll come back to us, and we can also reach out and contact you if you are interested in becoming a part of NYMAC or in some type of capacity. And so if you're interested in that, please either contact me, Radhika, or Cheyla, or fill out the Google form. Which
I think Fred will be dropping the link just now. I'll try to get it as well.
okay, that's what I was just looking for.
I've got it. It'll be in chat now. Thanks,
Okay,
all.
thanks.
Thanks.
Yeah, so that that's the Google link that you guys can fill out, or you can more than welcome to reach out to us personally by email. And if you want to continue this conversation, we're going to have an exhibitor hall later on at around 2:45 or 2:30, if I'm not mistaken, to just continue the conversations about the efforts in the regions.